Hi, I'm Holly. Welcome to 5-Minute Birth Classes. Today we are talking about chromosomal testing. So chromosomal testing or chromosome screening is something that's usually offered at the end of your first trimester. It is something that screens for abnormalities in the chromosomes or the DNA of baby and can look at like syndromes and other things which might predict difficult chronic complications that are lifelong for your baby. Some of these are not necessarily compatible with life, so it is definitely something that you have to be aware of. And also just be aware of the fact that you might have a baby that has a chance or a high risk of a syndrome, but it doesn't ever tell you how severe that might be. A really good example of this is Down syndrome. So Down syndrome is a chromosome abnormality called trisomy 21, where there's a third copy of the 21st chromosome in DNA. And this causes the symptoms of Down syndrome. But some Down syndrome babies and people are like living independently, obviously not the babies, living independently, absolute beautiful people contributing to society. And some people are born with like really serious heart problems with much more severe symptoms. So just because you have a high risk for one syndrome does not mean that your baby has no value, okay? You have to be very, very comfortable with choosing to do chromosome screening, because if anything comes back as high risk, you then have to like make a decision. So you just have to be very aware of that. There are two main types of chromosome screening here in Australia. There is the combined nuchal translucency screening test, also often called the combined test or the NT test. There's also the harmony test or the NIPT, the non-invasive prenatal test. We're going to start with the NT. So the NT is usually covered by Medicare, sometimes about $150 out of pocket for the scan maybe, but majority covered by Medicare. It's a combined testing of an ultrasound at about 12 weeks, but anywhere from 11 up to like just over 13 weeks, and a blood test that looks for a hormone called PAPA. So your PAPA level plus the thickness of a skin fold on baby's neck called your nuchal fold is like they're combined and they're tested and they give a predicted rate of risk factor. This also looks at things like, do you smoke? How old are you? Have you had a previous history of a baby with chromosome issues? So that will either come back as high risk or low risk, and if it's high risk, you're then introduced to other things that you have to think about. The harmony test or the NIPT is the non-invasive prenatal test. So this is a single blood test. There's no scan that you have to get with this one. And this looks for partial fetal cells. So when you're pregnant, one of the things that your baby does as they grow is they get rid of their old cells and give them back to you through the placenta to get rid of for them. So with a blood test, we can actually pick up like these partial cell fragments and test them directly for DNA and chromosomes. And that can give us like a very, very good understanding of, is there anything abnormal? Is everything fine? This is also how people can find out if they're having a boy or a girl like as early as 10 weeks in their pregnancy. This is not covered by Medicare in Australia and costs about $450. Both of these are great tests if you choose to do them. The mainstream one, or the one that's been around for much longer, is the NT. The harmony test is becoming more popular, especially because of the fact that you can tell what gender your baby is, but it doesn't guarantee any outcome. Now both of these are, generally speaking, very high quality results, but no result is ever guaranteed. And with the harmony test, if that's the one you choose, we also recommend doing an early anatomy scan. So just a scan of baby, usually between 12 and 14 weeks, just because some growth issues or some issues with baby's development can't actually be picked up in chromosome screening. So that is also something to kind of expect. And I'll see you next time.